Definition. Sprains and strains are common injuries that share similar signs and symptoms, but involve different parts of your body. A sprain is a stretching or tearing of ligaments, the tough bands of fibrous tissue that connect two bones together in your joints. The most common location for a sprain is in your ankle. A strain is a stretching or tearing of muscle or tendon. A tendon is a fibrous cord of tissue that connects muscles to bones. Strains often occur in the lower back and in the hamstring muscle in the back of your thigh. Initial treatment for both sprains and strains includes rest, ice, compression and elevation. Mild sprains and strains can be successfully treated at home. Severe sprains and strains sometimes require surgery to repair torn ligaments, muscles or tendons. Symptoms. Signs and symptoms will vary, depending on the severity of the injury. Sprains. Pain, swelling, bruising, limited ability to move the affected joint. At the time of injury, you may hear or feel a pop in your joint. Strains, pain, swelling, muscle spasms, limited ability to move the affected muscle. When to see a doctor. Mild sprains and strains can be treated at home. But you should see a doctor if you can't walk more than 4 steps without significant pain. Can't move the affected joint. Have numbness in any part of the injured area. Causes. Sprains. A sprain occurs when you overextend or tear a ligament while severely stressing a joint. Sprains often occur in the following circumstances. Ankle. Walking or exercising on an uneven surface. Knee. Pivoting during an athletic activity. Wrist. Landing on an outstretched hand during a fall. Thumb. Skiing injury or overextension when playing racket sports, such as tennis. Strains. There are 2 types of strains, acute and chronic. An acute strain occurs when a muscle becomes strained or pulled, or may even tear, when it stretches unusually far or abruptly. Acute strains often occur in the following ways. Slipping on ice. Running, jumping or throwing. Lifting a heavy object or lifting in an awkward position. A chronic strain results from prolonged, repetitive movement of a muscle. This may occur on the job or during sports, such as gymnastics, tennis, rowing, golf. Risk factors. Factors contributing to sprains and strains include poor conditioning. Lack of conditioning can leave your muscles weak and more likely to sustain injury. Fatigue. Tired muscles are less likely to provide good support for your joints. When you're tired, you're also more likely to succumb to forces that could stress a joint or overextend a muscle. Improper warm-up. Properly warming up before vigorous physical activity loosens your muscles and increases joint range of motion, making the muscles less tight and less prone to trauma and tears. Environmental conditions. Slippery or uneven surfaces can make you more prone to injury. Poor equipment. Ill-fitting or poorly maintained footwear or other sporting equipment can contribute to your risk of a sprain or strain. Tests and diagnosis. During the physical exam, your doctor will check for swelling and points of tenderness in your affected limb. The location and intensity of your pain can help determine the extent and nature of the damage. Your doctor might also move your joints and limbs into a variety of positions, to help pinpoint which ligament, tendon or muscle has been injured. X-rays can help rule out a fracture or other bone injury as the source of the problem. Magnetic resonance imaging (MRI) also may be used to help diagnose the extent of the injury. Treatments and drugs. Treating sprains and strains depends on the joint involved and the severity of the injury. Medications. For mild sprains and strains, your doctor likely will recommend basic self-care measures and an over-the-counter pain reliever such as ibuprofen or acetaminophen. Therapy. In cases of a mild or moderate sprain or strain, you should apply ice to the area as soon as possible to minimize swelling. In cases of severe sprain or strain, your doctor may immobilize the area with a brace or splint. Surgery. In some cases, such as in the case of a torn ligament or ruptured muscle, surgery may be considered.